Good afternoon, everybody. My name is Karen Eccles. I am the National Safety, Health and Welfare at Work representative for the INMO. I've been very kindly invited to speak at your conference today, and my plan is to outline why health and safety in our workplaces is so important, the legislation that is there to protect us, and the current health and safety strategy being driven by the INMO following arrangements agreed with the HSE in 2016 and 17, facilitating the implementation of 2 health and safety reps in all work locations and 1 in each emergency department. Occupational health and safety issues for nurses and midwives has long been recognised, and there's been active engagement by the relevant bodies to identify and improve same. SARS-CoV-2 pandemic has, however, brought to light increased awareness on what workplace activities impact on our health and safety generally, but also offer us now an opportunity and a platform to make significant changes and create additional awareness, which is so important, the responsibilities and duties of our employers, that they have to identify hazards in our workplace that directly affect us as nurses and midwives, and put in measures to control the risks as far as reasonably practical. Annette very clearly alluded to, obviously, the number of deaths that have currently taken place during COVID-19. It's always good to start off with the definition. The World Health Organization have a very good definition. They state that health is a state of complete physical, mental and social well-being, and not merely the absence of disease. And we need to aspire to that going forward. Nurses and midwives instinctively and naturally monitor risks to the health and safety of their patients. But today we need to reflect and create awareness on both the immediate and cumulative risks present in our workplaces that directly affect us as nurses and midwives. The clear objective of occupational health and safety is to prevent disease, injury and illness, and nobody should suffer a job-related incident or injury as a result of their employment. There's a lot of work being done in this area internationally and at a European level. Sorry, I'm just going to go back. Health and safety at work is recognised for the promotion of healthy workplaces, and health and safety at work, it's recognised that adequate control of both the physical and psychosocial risk in the workplace and compliance with the relevant health and safety legislation is essential for employers to reduce work-related ill health and injury. The dignity at work is self-explanatory. However, a workplace where everybody is treated with dignity and respect and where they feel valued will allow for good working relations, motivation and facilitate a happy work environment. Early interventions, as alluded to by Annette Kennedy previously, and awareness can do much to reduce situations developing, but it is essential that our managers are facilitated, obviously, with the necessary training to do this. Our work-life balance, psychosocial stress in the workplace. Examples of working conditions leading to psychosocial risks are excessive workloads, very familiar to all on the call today, conflicting demands, lack of role clarity, and lack of involvement in making decisions that affect the worker, and the lack of influence they have over their job can cause significant stress. Job design, excuse me. Job design is also important. Manageable workloads, shift patterns that are appropriate, good working environments and welfare provision, such as canteen rest facilities, that allow nurses to disengage during their breaks, increases job satisfaction, commitment and motivation. It's really important, particularly with public health nurses. Welfare arrangements have become self-evident, and the lack of them during the pandemic. Having a work break to go and eat is not just about going to eat, it's about being able to disengage, to rest your brain, to improve your cognitive function. And the facilities should be there. We should not be sitting in cars, eating a sandwich and trying to write up case notes. That's not what it's about. We need to change the culture of what we've done in the past to make sure we're healthy going forward in the future. The European Parliament Lifelong Learning Programme states it's essential to retain both knowledge and provide development opportunities so that nurses can continue to flourish professionally. And I think that's been clearly outlined by the advanced nurse practitioners that have spoken with us today. The healthcare sector in Ireland in 2018 had the highest rate of workplace absence as a result of injury and illness. 46% of the cases reporting musculoskeletal injury, and stress and anxiety was recorded as 22% higher than in other types of employment. So we know the statistics. In a recent labour force survey conducted annually in the UK, it identified stress, anxiety and depression accounted for 51% of work-related absences in November 2020. This is the first time that stress and anxiety have gone ahead of musculoskeletal injuries. So what in the workplace, why do we need to make sure that our health and safety is protected? Well, there are three arguments identified. The moral argument is that we should do the right thing. It's the right thing to do. People want to go to work and they want to come home safe and healthy to their families. Financial is fairly self-evident. Civil compensation claims as a result of injury and illness sustained at work increases the financial burden on the state, but also you and I as taxpayers. But ultimately, the legislation is what governs how the employer acts. The Safety, Health and Welfare at Work Act is the central and primary legislation that governs safety and health in the workplace in Ireland. I've cited 4 sections here relevant to us. There are many, but these are the relevant ones today. Under Section 8 of the Act, every employer shall ensure, as far as reasonably practicable, the safety, health and welfare at work of his or her employees. Under Section 13, yes, indeed, the employee has a responsibility and they have duties to take reasonable care to protect the health and safety of themselves and others in the workplace. Section 19, hazard identification, requires the employer to carry out a written risk assessment. The risk assessment should identify the hazards within the workplace and the risks associated from that hazard. And then they are required to put in the necessary control measures to mitigate the risk. Policies and procedures are very important when you're controlling risk, and I'll talk about those just going forward. What are the common risks for public health nurses? In the environments that you work, slips, trips and falls, musculoskeletal moving and handling. It presents a different challenge for the public health nurse. In the acute sector, you always have somebody to go to for assistance. You work alone. Longevity and cumulative risks to musculoskeletal injuries is very important for you. Violence and aggression in the workplace, work-related stress, staffing levels, patient acuity, caseloads, workloads, your working hours, your shift patterns, all of them need to look at from a risk assessment point of view going forward. As I mentioned earlier, welfare arrangements, canteen facilities, restrooms. Can you shower in your workplace? Are they, is the car park when you're coming back late at night adequately lit? Is the surface adequate that you're not going to sustain injuries? For far too long, nurses and midwives have accepted what has been delivered to us, but as Annette alluded to earlier in her conversation, the shortage of nurses going forward and the requirement for career longevity has never been more important. So when the employer has identified all of these risks, they're required to, under the Act, under Section 20, to prepare a safety statement specifying how the safety, health and welfare of employees is to be secured, and you should all be and have access to that document in your workplaces. They need to be site specific because not every work area will share the same hazards. So when you go back to your respective duties on Monday, it's a good idea, take a look at your risk assessment, see are they up to date, see are they relevant, and look at your safety statement if you haven't already. It gives a good overall picture of how health and safety should be managed. So how can we protect ourselves? Well, under the Safety, Health and Welfare at Work Act, Section 25, it entitles the employee to decide on and select and appoint a safety representative, or by agreement with their employer, select more than one to represent them on matters of safety and health in their workplace. The safety representative who accepts this management proposal has no legal accountability for putting health and safety in place. They're in a representative role, and that's important. What can they do? The health and safety rep, as assigned to an industrial representative, has different legal entitlements, and they're actually legal entitlements. They are legally entitled to carry out inspections in the workplace. They can carry out investigations. They can accompany an inspector if they come into your unit, and they're entitled to be members of the hospital or work location safety committee. The significant piece is that they actually receive reports on inspections conducted. Unlike any other representative, they have these specific rights, and it shows that experience shows that where workers get involved in making sure their safety and health is protected, it is more successful in that workplace. But more importantly today, it is really important that we fully understand that not only what protections are available, but that we're aware of what is there for us and that we actually start to use it. Because it's always been done this way, doesn't make it right. We get used to things. Cultural change, tolerance, and recognition of previously accepted poor practices need to be addressed. Safety representation, by electing your safety representatives, they can presently identify those issues and risks for you. And by identifying issues in the present, we will change of how nurses and midwives are looked after in the workplace. Considerations, really important. Aging in the nursing population has been alluded to by Annette again this morning. It's important. In 2017, it suggested that 65% of the nursing workforce in Ireland will be over 40 and 30% will be over 50. To compound the situation of inadequate healthcare workforce, we also have an aging population where it's estimated that 60-year-olds in our society will increase by 23%. That's going to inevitably increase the demand for nurses, increase in workloads, and subsequent risk. At an international and European level, the European framework identifies two elements that we need to consider and understand going forward. It states that ensuring that the workforce does not damage physical or mental health over the life course, and by controlling risks to all workers, especially those that are young and vulnerable. It also states that for workers to stay in work as they age, there is a requirement for creating good quality working conditions with appropriate work-life balance, employment opportunities, and again, it cites the lifelong learning. The European Working Conditions Survey also identified that healthcare workers registered lowest in the groups for career longevity, and I note pensions at the bottom of this slide. As a gender group, nurses don't generally do well in availing of their full pension entitlements for a variety of reasons. But in Europe and throughout, they're increasing the pension age. And we need to consider as a net different roles for nurses as we go forward. Being 68 years of age, is the target at the moment, 68 in an intensive care unit or in a patient's home in full PPE. Really, we need to consider how we're going to actually achieve that. That demand is probably unrealistic going forward to the future. So it's that cumulative risk and the long-term risk that we need to introduce among our nurses to make sure that that doesn't happen. What have the HSE in place? They have absolutely a plethora of information available to us. I've put up the Health and Safety Function Unit and the Workplace Wellbeing Unit. Hopefully you'll have access to my presentation afterwards, and a help desk. The HSE Function Unit is tasked by the HSE to provide effective, consistent, high quality and readily accessible support to employees. And they have a single contact point. So they look after centrally occupational health and safety, and they devise the policies and procedures that we work and use as control measures to make sure our workplaces are safe. I'm just going to mention a few of the policies that people need to be looking at. Obviously, the HSE Risk Management Policy 2017 has a lot of information for nurses and midwives. The Policy for Prevention and Management of Workplace Violence and Aggression, I'm just going to go over this because it probably gives a clear understanding of what we need to be really looking at. Under 7.3, it says managers must know and exercise the responsibilities in relation to prevention and managing aggression and violence in the workplace by the following: ensuring appropriate risk management processes are in place, ensuring that staffing levels are adequate to meet demands of the service, ensuring that there is adequate cover for night, weekend and shift changeovers to do your clinical handover, ensuring that employees receive appropriate supervision, ensuring that they receive appropriate training, really important, but also that there is a documented emergency response protocol in place. That's very significant. If you go back to your units tomorrow and you look at your risk assessments, see, are you compliant with more? Other policies that it would be good to look at are manual handling, people handling. Again, your public health nurse working alone, trying to manage manual handling, whereas in the acute care setting, it's different. Policy for the prevention and management of stress. Under the Safety, Health and Welfare at Work Act, workplace-related stress is a specific risk that is acknowledged in legislation. And in our workplaces, every workplace should have a management of stress in the workplace. A risk assessment for stress in the workplace should be able to identify a hazard of insufficient staffing. What are the hazards associated with that, and what control measures management have put in place to utilize that? There's the Biological Agents Codes of Practice. I'm not going to go through all of them. This is an awareness day to say this is the service and this is what's available to us. We must use it, but that your safety representatives, when you elect them, will be able to carry this forward, provide you with information and awareness on same. COVID-19 has had really significant impacts on people. I need to say that the Employee Assistance Programme in the Health and Safety Function Unit is available to all staff. It's a confidential, independent service if anybody's concerned about their mental health as a result of COVID and the current working conditions they possibly find themselves in. So what are the union doing? Great work. The INMO is supporting nurses, and they have introduced an INMO health and safety strategy. To date, it has trained 55 health and safety reps since May this year. I'll give you a brief outline at organisational level. They've used the Deputy General Secretary, has taken leadership of this. We have 4 Executive Council members. I'm delighted to tell you that Mary Tully is very active on this group for you as public health nurses, and is doing an absolutely fabulous job. The National Safety and Health and Safety Representative, myself, I'm charged with the recruitment of safety reps in each work location, the training of same when identified, and the management of the structure as we roll it out. Branch and safety liaison section officers are going to be elected. I'll discuss that in the next slide. And then the election of 2 health and safety representatives in all work locations. So to make it clear in this presentation, you'll be able to see it subsequently. At the top, this year, we're going to ask you again at your branch and AGMs to select safety liaison officer or a section liaison officer. You're very lucky as well. Your public health nurses are involved in this. Patricia, your chairperson of your section, is your safety liaison officer. But at branch level, the safety liaison officer will be asked by their branch officers to recruit 2 health and safety representatives in each work location. When they've done that, they will do a mapping exercise of the branch units that come into your branch for meetings. So it could be a community care unit, could be another hospital, but they will record those locations so that then we can move forward in building the numbers. I then will get the names of everybody. I will organise and provide the training necessary for their safety representative role. The industrial relations officers and IREs will support us in this, and as we go forward and people are going to get into place with this, the IROs and IREs will identify, along with myself, any issues that might be identified, and that will go back up to the Executive Council. And that's really important because we've set up a very good, robust structure, a beginning, a middle and an end, and there's a loop so that the safety representative is supported and can communicate throughout. The benefits of health and safety in the workplace, it's really important for public health nurses going forward to look at this. Awareness, your safety rep will increase awareness of health and safety well-being in issues in your areas. They'll influence management, health and support and safety for risk of staff. They would support cooperation with management on health and safety issues, and where safety representatives are involved, it is evidentially known that accidents, injury and workplace ill health are reduced. To cite the construction industry and agricultural industries, they have historically been identified as really high work risk places, but with significant engagement to reduce these risks, these workplaces have effectively been turned around. We can do that too. And they have a very good established and embedded safety representative structure with very positive outcomes. From the public health nurse point of view today, I think it is now essential that we as nurses and midwives address risks to us in the workplace. We're always constantly risk assessing for our patients, but we need to address the risks to us. We need to take this forward formally by electing safety representatives in all your work locations. The workplace risk assessment in the community requires the same level of engagement and interventions as those in the acute areas, and that's what your safety representative will be assisting in building forward, but also creating awareness. So some of the references that you'll find in the presentation: policy and procedure is really important when you're looking at risk assessments. Management should be trained in risk assessment is really important. If your managers have not had the training or they feel they need more training, they should look it up and get more familiar with it. Policy and procedures, the HSE Risk Assessment Management Policy is a very clear document and gives a lot of information for people to look at. The policy of prevention and management of work-related violence, I alluded to earlier. That policy, that's what you should be doing in your workplace to meet the requirements. You've got your manual handling and people handling policy. The policy for prevention and management of stress in the workplace. Again, psychosocial stress is significantly one of the heavy burdens, along with musculoskeletal, that are affecting us as nurses and midwives. And it is an identified hazard raised by the Safety, Health and Welfare at Work legislation. You should have a risk assessment for stress in your department. Policy on lone working, self-evident, really important, and that needs to be in place, up to date and actioned on. And the policy obviously very relevant to management of biological agents. You will have different issues and concerns in the public health nurses, and again, your Safety, Health and Welfare at Work representative is going to be vital in taking that forward for you. Sláinte care moving forward, the changes and transitioning from the acute sector to the public health sector is going to bring changes to this. There is a requirement under the health and safety legislation that if a significant change takes place in your workplace, that it must be risk assessed. So it's going to be very important for public health nurses when they're given information in relation to changes to practice, policy, or anything that impacts on their health and safety, they should ask for a risk assessment to be conducted before it takes place. This will allow for a smooth transition going forward, but it also allows for a positive cooperation. Health and safety is all of our responsibility. It's been really taken seriously, particularly COVID has driven this. It should have been there before, but every cloud has a silver lining, and this may be one that we share going forward. I thank you for inviting me to speak to you today. Your conference has been fabulous. I listened to everybody and I've learned so much. And your branches and your section officers will be working on safety representation in your workplace going forward. Please get engaged and put your names forward. It's an important role. It's a very rewarding role. And I look forward to meeting with some of those people maybe that will be generated from today coming forward. Thank you for your time.